Good evening. I'm Sayukta from Beautiful Spotless Skin team, and I'm sure all of you must be keeping good health. Hair loss, whether it is hair loss in men or hair loss in women, is a very common biological problem all over the world, not just in India. The importance of hair in enhancing the overall personality of a human being cannot be underestimated. Hair is the first thing that people normally notices about you. A great hairstyle can give you the personality boost you require in doing well in both personal and professional fronts. Hair loss, on the other hand, can prove to be a real disadvantage for many people. Many young boys and girls start losing their hair early in life, caused by a variety of genetic, environmental, and systemic factors. Hair fall can affect anyone, regardless of their country of origin. Thankfully, effective hair treatment can control and even reverse the hair loss process. So we are here to know more about hair loss, its management, and more in detail about hair care and how to manage it. So today, please join me in extending a warm welcome to our guest, Dr. Snehal Navande, consultant dermatologist and dermatosurgeon from Pune, to make us aware on hair fall and its management. Dr. Snehal is practicing dermatologist and dermatosurgeon based in Pune and has an experience of 7+ years in this field, along with clinical and pediatric dermatology. She provides a variety of dermatosurgeries and cosmetic treatments at her center. She is a lifetime member of Indian Association of Dermatology, Venereology and Leprosy, IADVL. Association of Cutaneous Surgeons of India, ACSI, and Indian Medical Association, IMA. So Keratis Clinic is a one-stop clinic for all skin, hair, and nail-related problems located in a prime and accessible premise at Baner, Pune, and her approach to skincare is unique based on principle of customized skincare for all age groups and skin types. Keratis Clinic provides an ideal combination of aesthetics and clinical care at optimal cost. A very warm welcome to you, Dr. Snehal. It's such a pleasure to have you with us. Good evening.
Same here. Hi.
So, doctor, today we are going to talk about hair loss. And when we talk of hair loss, there is no one, I think, who can say that I don't shed hair because it's so common. It happens with everyone. And usually on a routine basis, we see, hair shedding from our scalp. So, is there a circle? Is it natural that we will lose hair every day on a routine basis? Is it that normal?
Yes, shedding 50 to 100, even 150 hairs, like in winter season, is a normal. Okay. The hair has a 3 month cycle, physiological cycle,
Mhm.
in which the hair will takes 3 months to we see the hair in anagen, catagen, and telogen phase.
Mhm.
Telogen hair will definitely follow. Okay. So in the hair which is in telogen phase, that is going to fall. We see more hair fall in winter season. That is quite common. So it's normal to shed 50 to 150 hair every day.
So 50 to 100 hairs every day is
Yeah.
normal, but when to be alarmed? Because many a times we know that what's happening with us or on our scalp with our hair is not normal. We don't know exactly how many numbers are falling, but we know this is not normal. So which are those situations where we need to get concerned and go and visit a qualified dermat like you, doctor?
If you are seeing the hair on your pillows when you comb or in shower a lot, or when you are seeing your scalp skin more than the hair, the density is decreasing, or seeing a bald patch, in those cases, you must visit a dermatologist. And there are n number of causes. Usually it's nutritional. Nowadays people are on various diets, fat diets and all, restricted diets. Then if there is any surgery, post surgery also there is traumatic stress and all that. Then again, if the patient had fever, like in typhoid, dengue.
So there are so many reasons, causes responsible for hair loss, and nutrition or diet is one of them.
Yes, yes, important. Yes.
Right.
Nowadays, they go on restricted diet, vegan diet, just with keto diet. where there is only proteins, no
Intermittent
calories.
fasting, etc., where they
Intermittent
are not
fasting,
eating.
yeah, right.
Yeah.
Yeah.
Mhm.
So in those, that plays important role. Deficiencies are quite common. We come across B12 and D are the most common, even in men.
Mhm. Okay. Now,
Yes.
because you mentioned, diet and how important diet is for healthy hair. My question to you is, doctor, again, nowadays, people are so aware and there's so much of information, online,
Yes.
that we know that, okay, hairs are falling, maybe you're deficient on biotin or maybe on zinc or, whatever. We won't
Right.
go to the doctor first. We'll go to a chemist shop and get ourselves some, biotin supplements, or hair
Right.
gummies are so, much
Mhm.
in trend these days. Or from, some e-commerce site will get all these supplements and start experimenting on us. What's your take on this? How okay it is as a practice to go for these supplements or, hair gummies all by ourselves, not without consulting a doctor?
Hair gummies are not working. Okay.
Okay.
That's fact. There is no other yes or no for the hair gummies.
Mm-hmm.
Biotin can help, but usually we don't see much of a biotin deficiency. What we see, iron deficiency is quite common.
Mm-hmm.
So if means like this is something random. You see some Insta reel or something by a non-dermatologist or a influencer, and you go and buy these products, which are not going to help you. Ultimately, you have to visit the dermatologist. And when the patient comes to us, we first go, means along with the history and all that, it's like family history is also important. Along with that, we also go for the basic blood tests like B12, D, thyroid profile, if the patient has history of PCOS or something like that. So without investigation, giving something blindly is not at all recommended. And buying through Google Baba's advice or information is also not going to help you. Ultimately, you have to land up at
So it's
skin
always
clinic.
better
Yeah.
to, go and consult them first rather
Even
than
in
wasting your
in this
time.
in this
Yeah.
time, actually, you lose 6 months, 1 year also. You
Mm.
don't see results, and the bald patch starts appearing bigger and bigger, and it becomes difficult to reverse from there.
Right. So
So
it's always
instead of
advisable to
yeah,
go and consult a qualified dermat like you before, going for home remedies or over-the-counter medication, over-the-counter products, or going by what the influencers are saying on various social medias. Please save your time, your energy, your money, and most importantly, your hair, your health, and go to the right
yes.
person, which is a qualified.
Nowadays, the thing is that in old, there was an old saying, "Roti kapda makan." Now everybody has this roti kapda makan. What comes next is like health, and in that like going to gym and also taking care of your hair is the crown for you.
Right.
So that is also important, and now people are taking, means like becoming more and more aware about it, but instead of wasting time they should go to the right place.
Right. And yeah, of course. And because, hair are like a mirror to our health. If we are, healthy from within, it will get reflected on our skin, on our scalp, on our hair. So if you have healthy hair, or vice versa, if you don't have healthy hair, then probably there's something wrong within, our body. So it's important to go
Yes.
and get the root cause first. And only a dermat, a qualified doctor can do that for us. So please go to the right person. That's the important line. Now, as you said, diet plays an important role, and many a times it's due to iron deficiency, etc. How should our regular meal be like? I mean, what can we include in our thali? The basics. I mean, if we don't want to go for fancy or exotic fruits, etc. But in basic,
Yeah.
what can we include, which can help us keeping healthy hair?
Hair is a protein, that is keratin, it is built by the keratin. So protein is an important part. Amino acids, omega-3 fatty acids, then green leafy vegetables which contains iron like spinach, beetroot also is good source of iron. Then again including other colorful fruits and vegetables like orange colored fruits and vegetables, Then various colored fruits and vegetables give you more antioxidants, and that will reduce the free radical effect which is going on, like pollution is there and not good organic food is not available to everyone, right? So that kind of food is important. Proteins should be 1 gram per kg per day, but that much of protein is not possible for a vegan person. So at least 30 grams is important. In every meal, there should be a portion of protein, green veggies, and a little amount of carbohydrates. And minerals are also important. And they can include nuts also. And that's it. Means every meal should be a complete meal, not like I'm eating proteins in the breakfast, I'll eat carbohydrates in the lunch. It should be a complete meal at every point.
Right. So that's the right way to go for it. And, there are so many over-the-counter products like oils or shampoo, conditioners
Mhm.
that claim that they will, reverse your hair loss process, or they are anti-hair fall shampoos or anti-hair fall conditioners or anti-hair fall oils, or oils can actually help. I mean, that's how they promote or, endorse their products, that they'll regrow hair on your scalp. So again, do they really work, the oils, the shampoos, the conditioners in that way in regrowth of hair?
Okay, I'll tell what will not definitely work. Shampoos are just the cleansing agents like soaps. So any type of no type of shampoo will help you reduce the hair fall. Maybe mild shampoos or not sulfate shampoos will help to reduce the frizzy hair and the breakage, but not help in hair growth. Then no oils will help you, but like the little massaging, light massaging will increase the blood circulation. Oil is but mainly for the conditioning of the hair, not for the hair growth. It's not going to give you any hair growth. Any OTC serum, I don't see that will help in this. Mostly the um, peptide serums, which are usually prescribed ones, that can help. But OTC is not going to help much. No shampoo will work for the hair fall. It's not going to help, definitely. And conditioners are for the hair, not for the scalp.
Mm.
Scalp is where the root is there. So root is important rather than the hair now. For the hair, when we consider the hair growth.
Right. Now, there are so many chemical treatments these days, doctor. People are going for rebounding, foaming, so many things are there where a lot of chemical is used. Even in case of Botox or keratin or protein therapies, they are using a lot of chemicals, which ended up in hair loss many a times. Now, what's your take on, these chemical treatments? Can anyone go for them, or there should be a, we should draw a line that who can go, who can't, and what precautions should one take?
From my side, it's a big no to all these procedures. But in this fast-paced life, we want the hair to, means like ready to go hair always. So anyone who is going for this treatment should keep in mind that definitely there is hair damage, hair shaft damage. They will definitely going to see hair fall, not immediately, but in coming 3 months. So it is going to happen. It's definitely a damaging procedure. The salon procedure definitely will damage the hair. Yes, even the blow dryers also will damage the hair
Yes, yes, because
because
again, we are
it
using a lot of
will.
hot irons or straighteners, on a very regular basis, blow dryers. Again, what to do, doctor? I mean, with these things.
We have to try to avoid as much as possible the heating tools and all, heating procedure, heating tools, all these things.
Doctor, again, many times hair falls out when we shower or when we, go for hair wash. People are so scared. Many times they'll miss, or they'll avoid going for hair washes because they know
Yeah.
that it will make their hair fall. Now, is this the shampooing or the way we are shampooing that's leading to hair fall? All it's natural, as you said in the beginning. It's every hair has a life cycle. So is this due to that? I mean, what should we do? Because many times people won't wash their hairs for weeks because they are so scared of losing their hair while going for hair wash. So what is the right way?
The shampoo should be those who are having dry scalp or very thin hair, they should go for definitely the sulfate-free, paraben-free shampoos, or even the baby shampoos are the milder ones. They can use that. And about the hair fall, those hair which are destined to fall, like in telogen phase, they are destined to fall. Those hair will fall. The shampooing will be a nudge for that. Okay, so it's not worrisome if the hair is falling in telogen phase. Okay, and those hair which are damaged, which break at various lengths, those are due to the procedures, or the frizzy hair which has got damaged due to products or the heating procedures and all that. Okay, so it differs from person to person according to the scalp. If it's too dry, if the scalp is dry, not hair. If the scalp is too dry, we say to avoid washing it so frequently. You can wash it once a week also. If the scalp is too oily, we advise it 3 to 4 times a week in case of females. In case of males, they can wash it daily also with plain water or a very mild shampoo as a daily use shampoo. And shampoo plays an important role. It can lead to frizzy hair, and frizzy hair will break at various lengths, and the even cause the telogen hair to fall faster. So the harsh shampoos to be avoided definitely. But there shouldn't be any reason to avoid washing your hair as you are seeing the hair fall.
Right. Doctor, dandruff is again very common in our society, especially during winters, etc. People go through this. What is dandruff and how to deal with it?
Dandruff is actually the excessive outer skin layer, which is formed more in winters. And in this, if there is addition of any fungal infection, this inflammation increases. Even oil application increases this fungus and inflammation. So in this case, they can use ketoconazole shampoos initially. If that is not helping, then they can consult a dermatologist. In this case, there is one severe form of dandruff that we call as seborrheic dermatitis. It's quite recurrent condition. It will not go completely. The treatment, we have to do a focused targeted treatment initially. Even oral medications are needed in some cases, and later on we start with maintenance therapy, but it will again wax and wane according to the season. Seborrheic dermatitis.
Right. And doctor, again, because we are talking about dandruff and it's very common in our society, and again, a very common tendency or tradition that we have for treating, dandruff, a home remedy is to apply a lot of hair oil on our
Right.
scalp. And we think that it is the dry skin and the oil will help,
Mhm.
to deal with it. But many a times the opposite happens. So what's the
I
right?
already mentioned that oiling can lead to increase in the fungus.
Hmm.
So we definitely say ask the patient to stop oiling the scalp completely. In case of seborrheic dermatitis, it's for sure, it's like lifelong you have to avoid oiling your scalp. But
Hmm.
you can keep it for shorter duration once a week, like for 15 to 20 minutes before washing your scalp. You can apply that. The one means this oil is just going to condition your hair. It is not going to increase the hair growth or something else. A little bit of light massage will help, not like chumpy and all, that is not recommended. Light massage will improve the blood circulation for a minute or two. That's enough. And overnight application of oil is definitely not recommended. Not recommended.
Right. So I think it's a myth, and right.
Mhm.
And definitely it will accumulate more dust and can clog the pores as well. So oiling is a big no-no unless and until you use it as a pre-conditioner. You put oil on your hair and then go for hair wash immediately after that. Now, because we are talking about, hair loss and how to manage it, when a person goes and, consult a doctor, a qualified dermat like you for hair loss, as you mentioned before, that we go for diagnosis. And for that, we go for, investigation, tests, etc. After that, uh, what is the line of treatment? What are the treatment options available, doctor?
According to the hair loss, first is like if the patient is having just the hair fall, no baldness, in that case we call it as telogen effluvium. Mostly it's the nutritional cause, which is nutritional or some condition like typhoid, they suffered with, it's like COVID and all that. Due to pregnancy, they start shedding the hair faster because of the nutritional cringe at that point. So in that case, we investigate, we check for this vitamin B12, D, and all those deficiencies. Mostly iron B12 deficiencies we come across. In those cases, we supplement that and also start with serums, peptides, and usually we see improvements in 3 to 6 months. And if the case is chronic telogen effluent, in some cases we also do PRP for like mm, early arrest of the hair fall and avoiding the baldness which is predicted in future if the hair fall continues for a year or so.
Right. So treatment options are there. The bottom line remains
Oral
the same, that one need
medications,
to go
topical
and
solutions.
consult
Yeah,
the doctor at the right time.
right,
Right.
right, right.
Many times because, there are so many things that can lead to hair loss. As you also mentioned, diet is one. There are other things, hormonal disbalance.
Hormonal and genetic is there.
Yes, yes.
Yes.
So now talking about those who have genetic or have the fear of, genetic baldness, because if it's in the family, what can we do as a, precautionary measure? For example, if a person have, genetic history of hair fall or balding, can they go and consult a doctor early so that they can prolong or delay the hair loss thing?
Yes, definitely. In when there is a family history, if the father has lost the hair in his 40s, the kids will, means the child will lose the hair 1 to 2 decades early. So in 20s only they will see the hair loss and along with the balding. So in that case, if we go for we can't stop the balding completely, but in that case we can slow down. We can go with the oral medications, serums. There are few, means like there are quite misconceptions of the around these medications, but these are there since 10 to 30 years, and we give evidence-based treatment. So they definitely show the improvement if we start early. And if we can, means in these cases, hair transplant, in case of genetic history or family history, eventually these patients will require hair transplant, and we plan hair transplant around 25 years of age, because if we plan early, there is still hair loss going on. We don't know the pattern and all. Though we do the hair transplant, the other parts may show balding. So we have to wait till the hair loss becomes stable, and then we can go ahead later for the hair transplant.
Right.
The hair which is hair transplanted, though it is like mm, we don't need any treatment for that, but the natural hair definitely is going to be affected by the hormones and all. So for those hair, we need a maintenance therapy with oral, topical. Minoxidil is the, everybody knows that, minoxidil that has to be used.
Right. Now, Doctor, I'll take some of the questions which viewers are, asking.
Okay.
So there is a question, should I be concerned about excessive hair fall during certain season or time of the year? It do happens.
Winter is a season where you see more hair fall.
Hmm.
So if it's like alarming, if you feel it's more than 150, even I get patients who carry their hair in a box or in a bag to show that is this more. In case of female, the length of the hair is more. So even if there are 10 hair, that will be a bunch. But in case of males, it's like 3, 4, maximum 5 inches long hair, and those 10 hair will be the volume will be less. So you have to see first if it's definitely 100 to 150 hair or not. Then you can consult a dermatologist. But in winters, usually you see increased hair fall due to frizzy hair and all that. Yes. In
Right.
other seasons, you should consult a dermatologist as early as possible. Usually post pregnancy, you should consult a dermatologist. You will see hair fall not in like post pregnancy 3 months, but in 6 months, definitely you'll see the hair loss.
Hmm. All right. There's one more viewer, and the question is, can you suggest simple changes to my diet or lifestyle that may help reduce hair loss?
Okay, definitely. First is sleep. 6 to 8 hours of good sleep is important. Hydration is important. Stress is something we can't avoid, but we have to manage that with meditation, yoga, whatever you like going for a hobby, painting, playing with kids, whatever you like. Try to reduce that, manage that stress, whatever work or home related stress, whatever it is. That is also important. And along with that, in food, I already mentioned the protein is building block. That is important. Omega 3, though Indian non-vegetarian people, there are non-vegetarian people, they don't eat non-veg daily or fish daily. So omega 3 is definitely lacking. Either take supplements or start like religiously keeping the omega 3 things in your, like putting these in your food. Like there is flaxseed is there, chia seeds, in pumpkin seeds. Include these in everyday diet. That is important. Then colorful fruits, vegetables, iron rich food, calcium rich food, everything you have to manage it meticulously. That can definitely help you. Even for the skin, hair, it will help you.
Okay. Can accessories like helmets worsen hair loss?
Yes, yes, that can worsen if it's ill fitting. Helmets are compulsory, we can't avoid it.
Hmm.
So getting a good fitted helmet, which is bit ventilated, if you get it a ventilated one, that is better. And you can put a cloth inside the helmet. It should be kept clean. The helmet should be kept clean. All these things you have to keep in mind. Definitely the friction between the hair and helmet will lead to damage. Yes.
Right. One more question from our viewer. How can I minimize damage to my from styling tools and techniques?
It's quite a difficult question.
Yes, because
These
people
tools have,
end up using, I mean, it's so much
yeah,
in thing,
right,
right? Using hot irons or, blow dryers,
yeah.
etc. So can we do anything to, as a precautionary measure again?
I would suggest we usually go for these heating tools or flat iron and everything just to manage our hair properly. If the hair is not frizzy, if it's smooth, silky, then we don't go for these kind of treatments. So if we use a mild shampoo, good conditioner, leave-on serum any, or even a hair mask once in 15 days or something. Even at home, you can do this. So if you take really good care of your hair, even some, I have read somewhere, even the micronutrients like selenium, zinc can give you a better hair. The frizziness can reduce or dryness can reduce if you include all these things in your diet, or even the supplementation will help with this. If, I think if this 50% of your problems will resolve. Heat drying means like using of blow dryers to dry your hair daily is not at all recommended. Go for air drying your hair and don't use usual towels to rub your wet hair, dry your wet hair. Use any t-shirt is best if you want. Just dab your hair with a t-shirt. That will be recommended.
Mhm. Right. One more question. Is regular exercise beneficial for preventing hair loss?
Not exactly, I can say that it's not directly related, but definitely it will reduce your stress, physical and mental stress, even improve your blood circulation. So that's it. It's
Mhm.
not something directly related.
Right. We all know, doctor, that lights, sun rays, UVA, UVB, these are very damaging to our skin. Do they also damage our hair? And if yes, then what can we do?
Yes, they damage our hair. So avoid direct sun exposure to the hair also. We always say avoid direct sun exposure to the skin, but even hair get damaged. So you can cover it, use hat, wide brim hats will be helpful, or a cap or a scarf. And I haven't seen any brands in India, but I think it's available abroad. The hair sunscreen sprays are there. So
Mhm.
that can be used to protect the hair.
Okay.
And
And
washing the hair if it's dirty and all. So you can wash your hair daily also with a mild shampoo. Washing daily is no issue.
okay, doctor. And Dr. Snehal, before we wind up the whole session, any take-home message for our viewers?
Yeah, yes, we have already discussed all these things like diet is important, the same thing. Then sleep, stress to be managed well, and as soon as you like feel this is alarming, like more than 100 or 150 hair you are losing every day, you should definitely, instead of trying some gummies and all, which is not going to work as magic, you have to visit the dermatologist in time, because even at a later stage of balding, it's difficult to get back the hair with the procedures. Okay. So you have to be there in time. That is important instead of experimenting.
Right.
That's it.
Thank you so very much, Dr. Snehal. It was wonderful talking to you. Thank you so very much for your valuable time and this very informative session.
Thank you so much. Same here.
And viewers, thank you for your active participation. Stay happy, stay healthy, and stay connected. Take care. Have a good day ahead. Goodbye.